Why not all voice hearing equals schizophrenia? Voice hearing is often associated with schizophrenia, but not all people who hear voices are psychotic or mentally ill. The key is how the voices are experienced, how the individual relates to them, and whether the voices are distressing or impairing. Voice hearing can occur in schizophrenia and psychotic disorders, post-traumatic stress disorder, PTSD, bereavement/grief, spiritual or religious practices, dissociative identity disorder, DID. Normal non-pathological voice hearers, 10% to 15% of general population. 1, 2. How do doctors differentiate? Psychiatrists use structured clinical interviews, observation, and history to determine the context, content, frequency, and impact of voice hearing. Here's what they evaluate. 1. Nature and content of the voices. In schizophrenia, voices often comment on the person's actions, argue with each other, give commands, or say negative, critical things. 3. E.g., you are worthless. Everyone is watching you. While this tone is common, it's important to recognize that a small minority of people with schizophrenia report positive or neutral voices, and conversely, voices tied to trauma, e.g., in PTSD, can be extremely hostile or critical. Clinicians assess the overall pattern rather than tone alone. In non-psychotic experiences, voices might be friendly, neutral, or even helpful, for e.g., try the other road or you can get through this. Two, degree of insight. Schizophrenia, often lack of insight, person believes the voices are external and real. 5. Other conditions or non-clinical, the person may say, I know it's in my head, or it feels like guidance. 4. Insight is one of the strongest predictors of whether the experience is psychotic or not. 6. 3. Distress and functioning. Schizophrenia, voices cause major distress or impair functioning, social withdrawal, paranoia, inability to work. 7. Non-pathological voice hearing, some individuals find the voices comforting, inspiring, or even consider them spiritual gifts. Functioning remains intact. 4, 8. 4. Timing and triggers. PTSD, voices may be trauma-related flashbacks or inner parts with distinct voices, in dissociation. 9. Bereavement, some people report hearing the voice of a lost loved one. 10. Meditation/sleep state/isolation, hypnagogic hallucinations, falling asleep, and sensory deprivation can cause voices. 11. Doctors ask, when do you hear the voices, and, are you falling asleep or meditating? 5. Co-occurring symptoms. Voice hearing by itself isn't enough for a schizophrenia diagnosis. Other signs must be present. Frowny face. 7. Disorganized thoughts/speech. Delusions, false, fixed beliefs. Negative symptoms, flat affect, anhedonia. Paranoia or bizarre behavior. Neurological versus psychological versus cultural views. Neurologically, auditory hallucinations are linked to overactivation in the auditory cortex and misattribution of inner speech. 12. Psychologically, they may represent trauma, suppressed memories, or dissociated parts. 9. Culturally, many traditions, shamanism, mysticism, interpret voices as messages from ancestors, spirits, or divine beings. 13. Research also shows that the phenomenology, the experience of the voice, such as whether it's heard inside the head versus externally, or its volume and clarity, can differ across cultures, often aligning with local beliefs about its source, e.g., gods, spirits, or self. This level of cultural sensitivity is crucial for accurate assessment. Some psychiatrists now take a trauma-informed and culturally sensitive view of voice hearing. 14. Notable studies and movements. The Hearing Voices Network, HVN, supports people who hear voices but do not identify as mentally ill. It encourages non-pathologizing interpretations and peer support. 15. Research shows that 10% to 15% of healthy individuals report hearing voices at some point in their lives, especially under stress, grief, isolation, or spiritual practice. 1, 2. Summary table. Criteria. Schizophrenia. Non-pathological/other causes. Voices tone/content. Critical, threatening, commanding, usually, 3. Neutral, friendly, guiding, usually, 4. Insight. Often poor, voices perceived as external, real, 5. Often intact, I know it's internal, 6. Distress. High, 7. Low or none, 8. Impact on life. Disabling, 7. Functional life maintained, 4. Other symptoms. Delusions, disorganized speech, paranoia, 7. May be absent. Cultural acceptance. Often stigmatized. May be embraced spiritually, 13. Final thought. Voice hearing is a human experience that spans psychiatric, neurological, spiritual, and cultural dimensions. Doctors don't assume it's schizophrenia unless it's part of a broader pattern of dysfunction and loss of reality testing. 7:16. Detailed diagnostic considerations. Distinguishing between voice hearing as a symptom of schizophrenia or another serious mental illness, and voice hearing that is part of other conditions or even a normal human experience, is a complex but crucial task for mental health professionals. Psychiatrists and clinicians use a comprehensive approach, involving detailed clinical interviews, observation, and a thorough review of an individual's history and current functioning. They evaluate several key factors to understand the context, content, frequency, and overall impact of the voice hearing. Here's a direct comparison of how these factors typically present in schizophrenia versus non-psychotic or other causes. Nature and content of the voices. In schizophrenia, voices are often highly characteristic and tend to be negative, critical, or abusive. You are worthless, everyone is watching you. 3. As noted above, while common, some people with schizophrenia report positive voices, and trauma-related voices can be highly critical. Commanding, instructing the person to do things, often harmful to themselves or others. 3. Conversational or commenting, voices may argue among themselves, or provide a running commentary on the person's thoughts, feelings, or actions. 3. Bizarre or illogical, reflecting disorganized thought processes. 7. Perceived as external and persecutory, often attributed to external entities or forces that are hostile. 5. In non-psychotic experiences, PTSD, grief, spirituality, normal variation, etc. voices tend to be neutral, friendly, or even helpful/guiding. Try the other road, you can get through this. 4. Relational, the voice of a deceased loved one in bereavement, or a familiar, inner critic, that sounds like a past abuser in PTSD. 9, 10. Controllable or interactive, the individual may feel they can engage with the voice, or even make it stop, at least temporarily. While control is often maintained here, it's worth noting that individuals in treatment for psychotic experiences can also learn strategies to manage and interact with their voices, making control less of an absolute diagnostic marker than insight or functioning. Less complex or pervasive, often a single voice or a limited set of voices, not a constant cacophony. 4. Degree of insight and belief. In schizophrenia, a hallmark is often a significant lack of insight. The individual frequently believes the voices are genuinely external, real, and not a product of their own mind. This fixed, delusional belief in the reality of the voices is a strong indicator of a psychotic process. 5, 6. In non-psychotic experiences, individuals typically retain intact insight. They can usually say, "I know it's in my head, it feels like guidance, but I know it's not truly external," or, "It's like I'm hearing her voice, even though I know she's gone." 4, 6. Distress and impact on functioning. In schizophrenia, the voices almost universally cause significant distress, anxiety, fear, paranoia, agitation, lead to major impairment in daily functioning, social withdrawal, inability to work or study, neglecting self-care, and disrupt one's sense of self and reality. 7. In non-pathological voice hearing/other conditions, 4, 8. Distress can be present, e.g., in PTSD or grief, but it's often linked to the specific trauma or loss, not a pervasive loss of reality. Many non-pathological voice hearers report little to no distress. Some even find the voices comforting, inspiring, or consider them spiritual gifts. Functioning typically remains intact. The individual is able to maintain relationships, employment, and personal responsibilities. Co-occurring symptoms and overall clinical picture. In schizophrenia, voice hearing is rarely an isolated symptom. It occurs within a broader constellation of symptoms, including 7. Delusions, fixed, false beliefs that are resistant to evidence. Disorganized thoughts and speech, jumbled speech, illogical thinking. Negative symptoms, a reduction or absence of normal mental functions, e.g., flat affect, lack of motivation. Bizarre behavior or catatonia. Significant functional decline over time. In non-psychotic experiences, voice hearing usually occurs without these other hallmark psychotic symptoms. 9, 10. Timing, triggers, and context. In schizophrenia, voices tend to be persistent, often unprovoked, and can occur in any state of consciousness. 7. In non-psychotic experiences, voices often have clear triggers or contexts. 9, 10, 11, 13. PTSD, triggered by trauma reminders, stress, or specific situations. Bereavement, often occurs when thinking about or missing the deceased. Hypnagogic/hypnopompic hallucinations, occur specifically when falling asleep or waking up, normal phenomena. Cultural/spiritual context, occur during specific rituals or as part of a recognized spiritual journey. By systematically evaluating these factors, doctors can differentiate between a person whose voice hearing is a symptom of a psychotic disorder requiring specific psychiatric treatment, and someone whose experience is related to other conditions, trauma, or is even a non-pathological variation of human consciousness. The emphasis is always on the complete clinical picture, the individual's level of reality testing, and the overall impact on their life. 16. References.